Hi there, my name's Abby.
And I'm Christine, and we are nurses here at St. Peter's Hospital in the endoscopy department, where you'll be having your PEG tube placed.
We know that this process can seem overwhelming, but the more you familiarize yourself with your new PEG tube, the more comfortable you will be.
Today we're going to teach you the basics. By the end of today's video, you should be able to understand the following.
What is a PEG tube? How to care for your PEG tube site. How to flush your PEG tube safely and correctly. What restrictions you may have after your tube is placed. When it's important to contact your doctor.
PEG tube stands for percutaneous endoscopic gastrostomy tube. You may also commonly hear it referred to as G-tube. It is a thin, flexible tube that is inserted into the stomach through the abdominal wall. It allows for nutrition, fluid, and medication to be delivered directly into the stomach. Before we go over how to care for your PEG tube, let's take a moment to get familiar with the different parts of the tube itself. Knowing what each piece does will help you feel more confident and comfortable when it's time to use and clean your tube. At the end of the tube, there are two ports, one labeled for feeds and one labeled medication. These ports are where you'll connect a syringe or a feeding tube. You'll open the cap when it's time for a feeding, a flush, or a medication, and make sure you close it when you're done. You'll notice a small clamp on the tube. This clamp works like an on-off switch. When the clamp is closed, it stops anything from flowing in or leaking out. Always make sure it's clamped when the tube is not in use. Your tube has two very important components called bumpers. One sits inside your stomach. That's called the internal bumper. This keeps the tube from slipping out. The other one is called the external bumper. This sits right above your skin where your tube comes out of your belly. Together, these bumpers keep the tube stable and gently hold everything in place.
You will notice little numbers along your PEG tube. These are centimeter markings. They help show how far the tube is inserted into your body. Your doctor will tell you which number on the tube should be right at the level of your skin. Now that you're familiar with the parts of your PEG tube, let's go over one of the most important steps in caring for it, cleaning the tube site. You're going to want to clean your tube site once per day at any time you see leakage around the tube. Before you start, make sure you wash your hands with soap and water. First, you're going to want to take mild soap and water with gauze and clean around the site. Then, use Q-tips to clean underneath the bumper. Be sure to rinse well and pat dry. If applying a gauze dressing to the area, place a pre-split gauze around the tube on top of the external bumper. You never want to shove gauze underneath the bumper, as this can cause your tube to move over time. You will be sent home with a dressing covering your tube. Your doctor will tell you when this initial dressing can be removed. Once the area has healed, no dressing will be needed.
Now that you know how to clean your PEG tube site and keep the area healthy, the next important step is learning how to flush the tube properly. You should flush your tube a minimum of once per day. This is very important as it helps prevent the tube from clogging. A nutrition team will be providing you with a separate set of instructions, which will include a meal and flush schedule. To flush your tube, you're going to need a large syringe and a basin, both of which will be provided to you. First, draw up 60 ml of water into your syringe. Screw the syringe onto the feeding port of your tube. Unclamp the tube and slowly push down the plunger to flush the water through. Once the syringe is empty, be sure to reclamp the tube, remove the syringe, and recap the port. After flushing, make sure to always pull the plunger out of the syringe, clean with soap and water, and allow to air dry before your next use. When clamping your tube, try to remember to keep the clamp up close to the ports. This allows the doctor to easily fix the tube if it becomes damaged from being clamped over time.
There are some temporary restrictions after your PEG tube has been newly placed. Avoid strenuous exercise or heavy lifting. Avoid showering for 24 hours after your procedure. Avoid being submerged in water, which includes taking baths, swimming, or hot tubs for 6 weeks unless given the okay by your provider.
Earlier, we mentioned that there are number markings on your tube. Your doctor will tell you which number should line up with your skin. If you ever notice this number has changed, it could mean the tube has shifted in or out. If that happens, it's important to contact your doctor right away. You should also call your doctor if you notice any of the following: large amounts of drainage or bleeding from your tube site, increased redness or swelling, fever, more pain than usual, or if you're having trouble flushing your tube. It's important to know that mild pain and a small amount of bleeding are normal during the first couple of days after your PEG tube has been placed.
We hope this introductory video helps you start to feel more comfortable with your new PEG tube. On the day of your procedure, we'll go over all of this information again with you, both before and after the procedure, to make sure you feel prepared and supported.
We're here to help you every step of the way, and we look forward to seeing you soon.